Excuse me. I'm Sharath Raghavan, and I have an appointment with Dr. Kapoor this morning.
Good morning, Mr. Sharath. Please walk through that door. The doctor is waiting for you.
Good morning, doctor. I'm Sharath. I have an appointment with you today. Good morning, Mr. Sharath. I have been looking at your reports. Please have a seat. Doctor, is there anything I need to worry about? You have nothing to worry about, Mr. Sharath. Your symptoms are because you have stones, which are blocking your bile duct. What is the bile duct, and what does it mean to have stones in the duct? I can explain that for you.
This is the digestive system, and here is the liver. The liver produces a very vital cholesterol-rich juice called bile. The bile juice cleans the body of toxic byproducts that result from the breakdown of medicines and red blood cells. Bile is mainly stored in the gallbladder, which is a small pouch found under the liver and supplies bile when the body needs it. When we eat food, the gallbladder shrinks and pushes the bile juice out. Sometimes the bile salts and bilirubin, which is a breakdown product of red blood cells in the bile juice, can precipitate into pieces of stone-like material, which is referred to as gallstones. These stones can be very small, like grains of sand, or large, like the size of a golf ball. Gallstones can travel along with the bile juice and block the channels that carry bile to the small intestine and other parts of the body. This blockage of the bile duct causes jaundice, swelling of the liver and the gallbladder, depending upon where the stone is lodged. Sometimes the gallstones can block the flow of juices that aid in digestion by blocking the channel of the pancreas. This can result in swelling of the pancreas, which can be extremely painful.
So, Mr. Sharath, the reason why you have been experiencing nausea, vomiting, fever, pain, and yellowish color of the eyes is because you have gallstones, which are obstructing your bile duct. This condition may become serious if left untreated. Oh, don't look so worried. I can conduct an endoscopic retrograde cholangiopancreatography, or ERCP, which is a relatively simple short daycare procedure as compared to a surgery. ERCP will help you get rid of the stones and you can get back to work. Is ERCP a surgery? ERCP is a specialized technique where a thin flexible tube called endoscope will be inserted into your mouth, foot pipe and stomach in order to treat the blockages caused in the channels of the body. ERCP can be used in the diagnosis of certain diseases, but it is very often used in the treatment of gallstones.
ERCP is used when it is suspected a person's bile or pancreatic ducts may be narrowed or blocked due to tumors, gallstones that form in the gallbladder and become stuck in the ducts, inflammation due to trauma or illness such as pancreatitis or the inflammation of the pancreas, infection, valves in the ducts called sphincters that won't open properly, scarring of the ducts called sclerosis, pseudoducts or the accumulations of fluid and tissue debris.
Let me explain the procedure with a video that I have.
ERCP is a procedure that requires local anesthesia, which is administered as a solution that can be gargled or sprayed at the back of the throat. This solution may taste bitter and its effects will last for approximately 30 minutes. The doctor may also give you intravenous sedative that will make you sleepy and ease you through the procedure. The doctor will then position you either on the left side or on your stomach. A plastic piece will be placed in your mouth to prevent you from biting the tube or the doctor's fingers during the procedure. You will need to take slow deep breaths during the procedure in order to relax the muscles of your throat and foot pipe. The doctor will then ask you to put your chin to your chest and open your mouth. The doctor will ask you to swallow when the tube is pushed into your mouth. This will allow smooth insertion of the tube. You will be closely observed during the procedure, and if you choke, your doctor will spray more numbing medicine in your throat. Once the tube is inserted into the digestive tract, the doctor can examine the tract with the help of a camera that is fixed to the tube. A small amount of air is blown through the endoscope in order to make the tract more visible. This will make you feel bloated, but should not cause pain. Once the bile duct is spotted, your doctor will perform sphincterotomy, that is, the cutting of the muscle that surrounds the opening of the bile duct. This cut, which is less than half an inch, is made with the help of an electric current passed through a small wire, which is carried in a tube called a catheter. Sphincterotomy is not painful or does not cause discomfort. The stones in the bile duct are then pulled with the help of balloons and baskets which are attached to the catheter. Large stones are crushed and collected with the help of a specialized basket. Once the ERCP procedure is completed, the endoscope is slowly pulled out through the mouth. The doctor will ask you to clear your throat. You will be kept under observation for 15 to 30 minutes after the procedure in order to ensure you are fine. The IV will then be removed. This entire procedure will take 1 to 3 hours. ERCP is also used for the treatment of biliary strictures, the abnormal narrowing of the bile duct. This narrowing may be caused by surgical injury, cancer of the bile duct, damage caused by gallstones, swelling of the pancreas or bile duct. Benign strictures are mainly caused by scars and damages that are caused by a previous surgery. Malignant strictures are most often caused due to the growth of tumor cells within the bile duct. Treatment of strictures is achieved by balloon dilatation or by placing a stent that will allow normal flow of the bile juices. In the balloon dilatation procedure, the catheter is fitted with a balloon which is taken into the bile duct and inflated within a narrowed bile duct in order to stretch it. Most often, balloon dilatation is followed by stenting. A stent is a tiny tube which is made of plastic or metal. It can hold the narrowed duct open so that the bile juice can flow without any obstruction. Some metal stents are covered with a polyester material. This covering will prevent the stent from being displaced from its position. These specialized stents can also prevent the bile duct tissue from growing inside the duct. This way, the need for reinserting another stent can be avoided. Different patients will require different types of stents. Plastic stents are useful in treating patients with gallstones and benign strictures. However, owing to the high rates of tissue regrowth seen in patients with benign and malignant strictures, metal stents, particularly the more recent and advanced stents which are covered with polyester covering, are preferred. Based on the severity of the bile duct narrowing, your doctor will decide the stent that is best suited for you.
How do I prepare for this procedure, doctor? That's a very good question, Mr. Sharad. The stomach should be empty and hence you should fast for at least 6 hours before the procedure. Keeping your stomach empty will help me get a clear view of the stomach. Also, the risk of inhaling the contents of your stomach during the procedure can be avoided. Take time out to discuss with me the medications you are currently taking, any allergic reactions you may have experienced in the past. You can continue to take the routine medicines, but bring the list with you during your clinic visits. Conditions like diabetes, heart or lung diseases, or the use of medicines such as blood thinners should be brought to my notice at least a week before the ERCP is scheduled. I don't use any of these medicines, doctor. I have no other diseases too. Oh, that's good. On the day of the procedure, you will need to change into a hospital gown and remove all metal objects from your body. This is because ERCP is conducted with the help of an X-ray machine and metal objects will interfere with the X-rays. Once you're ready for the procedure, you will be given a local anesthesia and intravenous sedative before the procedure. A small plastic suction tube will be inserted into your mouth to drain out the excess saliva.
Okay.
After the procedure, your doctor will keep you under examination until the effect of the medications wear off. You may feel slightly bloated and pass gas because air is pumped into your digestive tract during the procedure. In most cases, there is no need to have a special diet before and after the procedure. However, it is best to consult me before eating. It is always advisable to have someone accompany you after the procedure because you will be under the effect of the sedative used during the procedure. That seems quite simple. Are there any complications for the surgery, doctor? ERCP is a well-tolerated procedure, Mr. Sharath. Specially trained and experienced doctors always perform it. In very rare cases, patients may experience swelling of the pancreas, infections, holes in the digestive tract, bleeding, allergies to the sedative during the procedure, or damage to the teeth crown. These complications are very rare and can be rectified, but will need hospitalization. It is important to stay in touch with our medical center and report any discomfort immediately.
Oh, that's a relief.
There are some things you need to keep in mind during and after the treatment. You have to maintain a healthy weight, and if you need to lose weight, this should be done gradually because sudden weight loss can increase the risk of developing gallstones. Include lot of vegetables, fruit and whole grains in your diet. Avoid high-fat diets. Alcohol intake should be highly restricted. I feel much better after talking to you about my condition, doctor. Thank you for sparing time out to explain the procedure so well.
So talk to your doctor today.